Hi, I'm Nancy Brown, and I'm here in Southern California at Dr. Hirani's office, who's my post-treatment doctor after Lyme treatment. I was diagnosed with Lyme in 2012, November 2012. And before I could get that treatment, I had to get a power port, so they could access all the, well, Doc, you'll know better than me, but they had to access all the vitamins and the nutrition that I needed and the antibiotics. And after that treatment, I was left with the decision whether or not to keep the port. And I decided to do that, and a lot of Lyme patients can probably relate to this, because I wanted to continue that. I wanted to continue to get all the nutrients that were available to me at an office similar to this. So, so Dr. Hirani offers that, to be able to flush the port and take care of it properly and give me the nutrition that I need to stay healthy with this disease. So I was wondering if you can kind of talk about that a little bit and what it's all about, the port.
Absolutely. So when the use of power port is usually to administer chemo and sometimes specific dyes for radiology imaging procedures. And the idea is to preserve the integrity of your peripheral veins, because if you were to, give continuous IVs as you were getting on a daily basis, that could really destroy your peripheral veins. So the idea of using a power port is you're accessing a larger central vein in your body. Exactly. And you're preserving your veins, and this access here can be done, anytime. The power port is kind of shaped kind of like a little diamond almost, and it's placed subcutaneously right under your skin in your chest right here, and it has like a tubing that it's attached to that actually they make an incision into one of your veins here, like your jugular, and they make an incision and they insert it in, and now it's actually in your intravascular system, not too far from your heart actually.
Right.
And so once it's fastened in, by your central vein here, it's fastened so it can't move. But you can actually kind of see it. You can even palpate it, or you can touch it right here. And but it goes a little bit deeper under your skin, and then you can see the power port here. So what the power port has is it has a little membrane right over it. And that membrane is what the nurse will use. It's kind of shaped like a hook, and it's called like a Huber needle. And the nurse, after she has properly sterilized and used the betadine to clean up the area, she's wearing a mask. Sometimes a patient will choose to wear the mask. Too, She has to use sterile gloves, and then she uses the sterile Huber needle to, poke a little hole through that membrane that is, this whole contraption is right under your skin, so it's subcutaneous. So she's going through your skin and through that membrane, and now she's into the power port. And that needle now has access to your central vein. Right. So the first thing we want to do is we want to draw out a little bit of blood and make sure that we're in the right space. And then and once we've drawn out some blood, then we'll flush it. And the flushing is usually with saline. And then depending on whether or not we're going to be drawing blood on you that day, if we're not going to be drawing blood on you that day, once we've flushed it with the saline, we'll hook you up to the intravenous IV, and the IV is going to be dripped in, or if we're going to be giving you a vitamin push, which is, a quick push over 15 minutes, whatever it is, you're hooked, you're good to go. Once she's finished giving you the IV, she'll pull out the Huber needle. Before she pulls out the Huber needle, she disconnects the IV contraption, and now she'll flush again. And during this time, you're also flushed with heparin. And the heparin is given because you want to keep any blood that might be, anywhere in that whole catheter system that's in your central venous system. You don't want any blood to sort of stick there in the catheter and then clot up, because causing a blood clot like that could lead to a lot of problems. Absolutely. Like an embolus or something. It can go to the brain or whatever, to the lungs, and you could have a pulmonary embolus. So what the heparin does is it just temporarily just thins out the blood. So if there is any blood that's, you know, stuck around there in the system, it's all gone, basically.
We see why I really took time to find a doctor like Dr. Hirani, who knows what she's doing. I know some people do it at home. I would never do that, so it meant a lot to be able to find her to do that. And in our next video coming up, we're going to do a demonstration of that. So it just sounds a lot worse than it is. It's actually very easy. Thanks so much, Dr.
You're
Hirani. I
welcome.
really appreciate it.